Happy Women's History Month. My name is Ann Cinnamon, and I am part of the leadership team here at CriticalArc. I am really thrilled to be moderating this webinar focused on women's safety in both higher education and healthcare settings in the US and Australia. So it'll be really interesting. We're going to hear from our esteemed panelists in these sectors as they share best practices, strategies, and really kind of real world experiences to create safer environments on and off campus. This session is going to explore key challenges, proactive solutions, and collaborative approaches that organizations can adopt to enhance safety and support the well-being of women in educational and healthcare spaces. So whether you're a university leader, a healthcare professional, or student advocate, this discussion will equip you with valuable insights from peers facing similar challenges. So with that, let's hop in. We are going to start with a round of introductions. So I will kind of go around and tell everybody, but please share your name, your role, and talk a little bit about the organization you support so we have a sense as to the environments that you're kind of living in, working in, and managing. Kylie, let's start with you.
Thanks, Anne. Good morning, everyone. I'm Kylie, and I'm the Manager for Governance, Quality and Risk. I'm in Melbourne, Australia. I work with a community health organisation. We're a not-for-profit organisation in the western suburbs of Melbourne. We have quite a breadth of clients that we support, and we have quite a diverse community and a lot of vulnerable clients that utilise our services. Thank you, Anne.
Wonderful. Thank you for that. Carrie, you're next.
Excellent. Thank you. I am Carrie Ramsdell. I'm the Chief of Police at Endicott College, which is a nonprofit, small private campus, liberal arts campus here in Beverly, Massachusetts, which is in the States. So we're a little bit about 45 minutes north of Boston. And yes, we're, like I said, a liberal arts serving, students from all over. We're mostly a residential campus, so about 95 to 98% of our students that are seeking their college degrees reside on our campus. So it's highly residential and a little kind of suburban. It's also oceanfront, my campus too. So about, a quarter of my campus borders the ocean. So it presents its own challenges, but that is me.
Absolutely. It's a beautiful campus. I have been there. All right. Tara, you're up.
Hi everyone, Tara Murphy. I'm Director of Protective Services at the University of New South Wales in Sydney, so a bit north of Kylie in Melbourne. So UNSW, a leading research intensive university. We have over 70,000 students enrolled, over 7,000 staff. So yeah, my role basically is overseeing campus safety, including the guarding function, electronic security systems, and emergency and critical incident management.
Thank you. And last but not least, Chief Hill.
Hi, Loretta. And I'm the Chief of Public Safety here at University of Southern California in Los Angeles. And we serve a population size similar to Tara, about 80,000 students that we serve here, about 8,000, 8,500 employees. It's a huge research university. And if you're a big sporting fan, we have a lot of that too. A lot of Oscars since that just happened. So a lot of prominent people that have attended here, University of Southern California. And my workforce that I oversee, which is Department of Public Safety, is one of the largest public safety departments in the university setting, which is about 300 of public safety personnel that I supervise. So.
Thank you so much. Great. Well, appreciate all of that. That's very helpful background to kind of get the variety of perspectives that we'll hear today. So we'll start with the first question, and that is, what are the most pressing safety challenges women face in higher education and healthcare settings today, and how have these challenges evolved over time? I don't know who wants to go first.
I'll go.
Yes, please.
So I probably would say I've been working at the university here for just over 13 years. For me, I think currently the pressing challenge is the increase on online harassment that we see across the university, and particularly for students. So I think that online landscape has provided an opportunity for that harassment to play out. I think additionally, I think the evolving piece, I just think there's more transparency now. There's a lot more transparency from the organisation in disclosing reporting numbers. So it's very visible what is happening on university campuses. And I think that's something particularly triggered maybe in the last sort of 7 or 8 years that I've seen.
Interesting. Chief Ramsdell?
Yes, sorry, just had to unmute myself. It's funny Tara mentioned that, because that's kind of what I was going to say in the world of online digital presence and stuff like that. But here in the States, in my campus in particular, it's also the element of accessibility for women, that the way that they're able to be tracked, or people are able to know what they're doing, and it's on our women, on behalf of our women too. We share more online, so people are more often aware of where we are, what we're doing, or our patterns, or our likes and dislikes. So it presents a little bit of a risk in that sense for us, I think. Here is sort of that women are a little bit more open and more accessible than perhaps, again, if they're in an unsafe situation or relationship or whatever it is, that it is just another thing that they have to think about risk and manage, that they might have to think about more than they have in the past. I think in the time, again, the role of social media in all of our lives, especially women, is hugely important. But how do we do that in a safe manner that still protects us as an individual and as a student on some of our college campuses, where people are, like you said, are much more transparent and outgoing about a lot of things. But how do we still kind of have that safe borderline there, I think.
And I'll probably add, from a healthcare perspective, we have a high proportion of female workforce, and gendered violence is something that we see in healthcare. So a Safe Work Australia report showed that 40% of people they surveyed in community and health services were exposed to violent and traumatic events, and predominantly male to female violence. So it is a real issue in healthcare, and in community health we offer a lot of in-home, off-site type care services. So it in itself creates greater risk to our staff that we have to manage, who are going to work in an uncontrolled environment off campus.
And I would just add to that, definitely the accessibility to cyber and the cyber bullying. And we have a huge international population here at USC, about 28%. And so we've had students that have lost millions of dollars to scams. So that accessibility too, to find out who they are, enough about them, to threaten them in a way where they perceive it is actually happening. Even though we have these orientations and we tell them, do not fall for this scam, and we put out community alerts, and they will tell us it was so real. I believed it. And before we know it, they've turned over $15,000, $20,000, $30,000 before they realize. They call us, and some of them even to the point they'll have a name of someone that works with us, the scammers. And so just being present online opens them up to, and then we have a lot of, that's that kind of safety. But then it's psychological safety, because
Mm.
you see these alerts that go out, because here in the States, we're required to put out alerts about certain crimes. And so people see these alerts go out and they say, okay, am I really physically safe? Because I see these alerts. And so sometimes we're working people's perception of the safety. And of course, I'm in LA, right? Of safety in LA versus the actual crimes in LA. So we're dealing with both of those, the cyber world and then people's psychological safety, but also their physical safety, because they see these crimes that we have to put out that are occurring around the campus, but they're a minuscule number compared to the overall crimes that happen. So we fight against that perception of safety with our women in this community. And intimate partner violence, someone mentioned that. We deal a lot with that, with females for the first time, a lot of them being away from home and not knowing who they can trust, who they can talk to, and they end up in these really volatile situations with intimate partner violence.
Yeah,
Yeah,
I think that's probably a important thing in regards to the international student community. We again probably around 30% international students, but as you said, Loretta, sort of starting in a new country, learning a new culture, trying to build those relationships with your peers can be quite isolating for some. So they do become a little bit more vulnerable, I think, especially in the online community.
Thank you both. Yeah, we talk a lot about that feeling safe versus being safe, and you need both. So, all right. Wonderful. We will pop to the next question. And actually, I'm going to pause really quickly. For our audience who is listening in now, please feel free to put any questions in the Q&A. I'll try to be good about looking at them. And if we have time towards the end, we'll definitely get to those, but please enter them whenever you would like. All right, our next question is, can you share examples of successful strategies or programs that have effectively improved women's safety in your institutions? What lessons were learned? Anyone can go first.
I can jump in. We have it's pretty popular here in the States, and I don't know if it, to be frank, if it's really reached Australia or from other countries where people are listening from it, but it is an international sort of self-defense program. It is the RAD program, so rape, aggression, defense. Is Loretta's looking at me, so she understands. But it's the RAD program, and we have several officers that are trained in it. And it's not just about the physical, hands-on tactical defense mechanisms. That's a piece of it. But the biggest part of this program and sort of strategy that we offer to our women here at Endicott is it's about the power of your voice, and not just the power of consent or whatnot, but it's how to take a step and step up for yourself, how to start figuring out, what is safe, what is unsafe, some sort of key things, psychologically, as you said, what makes sense, what doesn't make sense. Is this a safe situation, unsafe situation? And then think about how to use that voice and how to empower them to step up and have a role in protecting themselves. It's not, obviously, as we said, a lot about it might be, intimate partner violence, and it might be a male aggressor, but it might not always be in that situation. It could be an everyday interaction they're having, but how to have some awareness of what's around them and have that sort of risk assessment piece of it. So that's sort of one program we offer here at Endicott that's really big, and I promote it mostly because of the empowering factor, not because of the physical hands-on kind of self-defense strategies, but our women that go through it just speak leaps and bounds. And here in the States, I know that the statistics are high as far as how many times it really has protected our women, especially on our college campuses. Again, for all those reasons, as we said, they're in a new environment with new people and whatnot. So that RAD program is really been a success for us here, I would say.
In healthcare for us in community health, some things that have been very helpful for our staff. We've had a bit of a multimodal approach where we've provided de-escalation training, and that training involves both theoretical and practical aspects of de-escalating an escalating situation. We've had paid actors who come in and demonstrate and give staff the opportunity to actually engage in the desk and practice the de-escalation skills. Another really critical aspect for us is a really strong safety culture from the leadership down, and a really strong visible leadership commitment to safety, and that staff safety is paramount. And our leaders really demonstrate that by example. They walk the talk, they are there and they support safety with our staff, and they put the resource in towards that. Desktop drills are really powerful for building that muscle memory in how to respond when your adrenaline is pumping and you're not thinking straight. So having that continual practical training is really critical. And I will bring up our safe zone duress system that we implemented, because that has been a cornerstone to our safety for our staff, because our staff, as I mentioned earlier, do often work in off-site, uncontrolled environments. We do risk screening before staff enter an off-site or a client's home. However, on the day, you don't know what that situation may look like. You don't know who may visit that home whilst you're there, for example. So having the ability to quickly and safely raise an alarm if you get in a situation where you're feeling unsafe has been really critical for our staff to feel, one, very well supported, which is the feedback they've given us, but also having in an emergent situation, having that in the palm of their hand has really made staff feel much safer. And we also look at I guess the pointy end is where we have had repeat clients who are high risk to the safety of our staff, that we do look at whether they are suitable to be receiving services at our facilities. And that again is demonstrating that leadership commitment to staff safety.
And I would just add, I'm gonna change my background real quick so I can talk about that culture of safety. So this is one of our mottos that our administration has embraced and adapted. It's our One USC safety vision. And part of that is that safety is everybody's responsibility to keep our students and faculty safe. And if they're safe physically and psychologically, then they can pursue what they're here for. So they can pursue all those aspects of their life and they can be great. We can have the next person that cures cancer. We can have the next Oscar winner, the next Heisman Trophy winner. We can have all of that if we give them that One USC safety vision, making them feel safe in their persons, in their space where they're here. The RAD training, we have people, it fills up every time. We have a waiting list always for RAD training. So we get asked by different departments, would you come put on, something, a scaled down version, but it includes de-escalation, that includes how do I keep myself safe, walking at night, what do I need to do? So in addition to the RAD, the safety culture that we have, we make an effort to spend times with our fraternal and sorority organizations and our student and our affinity organizations here to also provide them that training. So we'll have, we have on our website, these are the type of trainings we can do for you. Call us. We will send someone over to do that training. And a lot of times we end up with groups of females that just need to figure out how to navigate LA. That's not an easy place. This is not an easy place to navigate. But what things that they can do to make sure that they're safe. And so, and I think that those kind of things pay off. I want to also talk about internally, one of the things that I believe that's created some safety is putting the women within the department here in leadership roles and allow them to give me share their voices and their ideas on what we can do to better serve our community here. So putting them on employee advisory committees and different things like that to help me to make sure that I'm hearing people's voices, and that the same thing we're providing our students, we can make sure they're providing to our staff also, because they have the same things. They got the internet, we got intermittent partner violence. We have the same thing with our staff as we're having with our students.
I think from a university perspective at UNSW, we've had in the last 3 years, a gendered violence strategy that has been led by our Vice Chancellor, but it was very much a collaborative strategy development, involved all cohorts across the university, from students to staff, external agencies as well. And from that came a strategy with lots of actions from that. Again, like Kylie said, Safe Zone was one of the sort of requests that came through from our student cohort. They wanted the ability to have a mobile address button in their hand, as opposed to trying to find a help point, a fixed location on campus. They felt that would help and make them feel safer on campus. So that was supported by the university. But also, I think it's sort of those business as usual things for our department, ensuring the campus environment itself is maintained and kept safe. So lighting audits are done twice a week. We ensure through our contracted security team that we have female security officers available 24/7. We are a 24/7 operation, so we need to ensure we have a safe environment where females do feel that they can come and report to us. We want to be seen as accessible as a department. And also, I think it's that embedding that safety culture and respect. So there's been a lot of training programs rolled out through that strategy, not just for students, for staff as well. And some of those things are mandatory. And I think it's about making it very visible across the university. So there will be lots of campaigns all across the university, and our VC has a very safety focused agenda, in the sense that most of his town halls, etc., start with a conversation around safety and respect. So I think it's really important that that is led from above and very visible.
Wonderful. And interesting to hear that kind of on both sides. We're hearing that coming from the top is key to having it flow through the rest of the org. All right. We're going to switch gears a little bit. The next question is, how can universities and healthcare organizations collaborate with policymakers, law enforcement, and community groups to create safer environments for women?
Well, I'll jump back in. I suppose just from my perspective, one of the strategy actions was to set up a Safer Communities team at the university. So they put through some dedicated resources now around gender violence, and they have regular committee meetings, which our law enforcement team, our local law enforcement agency, come and attend and provide input from the general outside university environment. So it's really important to have their input. And of course, then those minutes and actions and recommendations from that Safer Communities committee then goes up to our university leadership team. So again, there's transparency at that senior level around how we're tracking against our actions. And again, students are part of that committee. So it's a all of university approach to maintaining that culture.
I'd have to say I agree, Tara, with the sentiments you're discussing there, and that transparency, openness, and ongoing discussion, and the opportunity for staff to contribute to those discussions, to be heard, and also a feedback loop so clients, staff feel heard, is really important, and data is very powerful as well, particularly if you're looking to advocate at a policy and resourcing at a government level?
And I would just add, we have several cross-functional teams that meet to discuss those type of high-level policies that are not just one groups or the others, but the university policy. We also, because Carrie knows there's a lot of reporting requirements here in the States. And so we have a team, our EEO, which is Equal Opportunity Employment, and our Title IX team that meets twice a week to vet cases, incoming cases. We have we call them they're basically our teams that get together that go over potential cases to see where they need to reside, who needs to work them, what policy they implicate. We also have some threat management teams because we have obviously healthcare, a whole Keck hospital. So we have a whole hospital and a healthcare system there. So we have two different teams that meet, and it's not just the outward threats, but it's potential problem or students that are identified that are at risk or at need for different reasons, including and staff. So we have those twice a week too to make sure that we're understanding kind of what's going on. And then if we need to have our teams to meet to discuss to make sure that we're in compliance with the federal laws and that we're providing those opportunities to vet these cases and try to catch them before we have women or other people in situations where they do not feel safe. And so these are types of things that we do weekly, and it takes a cross-functional team. And when I say that, it's the Hollywood squares. I mean, it's so many people on the call, but you need them because every unit has something to offer and look at it a different way. So I just bring just my public safety perspective, but I have people across the entire organization, the university, that also have input on those policies and ideas.
Most of my things have been hit on before, but Kylie mentioned it slightly too, and Loretta, you just did as well. But the surveying of our clientele, a climate survey, they tend to call it for us, is a state mandate for us. We have to push out to our student population a climate survey on the student safety, and then report, as Loretta said, reporting aspects and sharing that with their state, and that is utilized just as this question asked, sort of like, to create that safer environment to guide policymakers, lawmakers, and adjust how we need to resource deployment and whatnot too. But that what starts as sort of a mandate is a great sort of takeaway for us and a positive to say, this is good information we were collected. We were mandated to collect it, but now how do we use this and really look internally to create that safe environment for our women, because it tends to, again, drill down on the sort of gender-based violences for us here in the Massachusetts, at least,
Okay, interesting. So we're going to go back to the leadership topic that some of us have already kind of touched on previously and dig in a little bit deeper. So the question is, what role does leadership play in fostering a culture of safety and inclusivity? And how can institutions ensure that safety initiatives are sustained over the long term?
I'll go. Okay.
You go.
Well, I was just it starts at the top, the very top. And I've had the privilege since I started here 2 years ago at University of Southern California to have a female president that I look to as a bold, intentional leader. And I think that's one of the things that you have to have. You have to have a leadership that's bold and very intentional on programs that are inclusive of females, of women, and to make sure that those needs are met that are maybe different than the male counterparts that are students and our staff. And so you have to have someone that embraces that. It starts at the top, that are very intentional and they're bold in their efforts. Our president calls a lot of the huge initiatives she's undertaken her moonshots. So I'm using one of her terms. You gotta have moonshots. You got to be intentional. And I think I'm safe. I've been doing this 31 years. So my filter, I don't have as much filter as I used to when I was a young cop. That inclusive is not a bad word. being exclusive and designing things for women to make sure that they are accepted in the school, the workplace, in the environment they're in, and making them feel safe so they can produce and be the best that they can be. It has to be intentional. And sometimes the program, I'll tell people, is this just for women? Yes, it is just for women. You are welcome to be a part of it, but yes, it is absolutely just for women. And I'm comfortable saying that. And you got to have bold leaders that are comfortable saying that too.
And I think, Loretta, that's a really good point around having a psychologically safe environment where people feel free and able to speak up, and women in particular having a voice. And that does come very much from the top, setting that bar. We have a female CEO who set that standard for us. In leadership, and sets the organization culture, which is a really one of safety.
Yeah, I think I agree. I think having that diverse university leadership team really does help when it comes to maintaining this culture. I think, as we say, it can be quite easy to put a strategy together and have a sit and forget. The strategy's done and then it gets put on a shelf, but it has to be driven, and it has to be continuously driven, and it has to have resourcing. There's a lot of actions to be done. So the university, as well as putting a strategy together, needs to support it with funding and resourcing to ensure that it is maintained.
And I think to that point, Tara, too, the question really kind of centered on how do we sustain sort of women leadership roles and maintaining that culture of inclusivity. And I think for me, it's all of the things everything said, but as well as bringing the next generation on. That oftentimes we're like, yes, we have a woman, president, we have a woman chief. That's great. We're all in these positions. How great is this? But that's great. But we need to continue to build that. So it's bringing the next generation with us, breeding that within that culture, but physically bringing them to the networking events, to the meetings, to the webinars and stuff. So they realize that, it's great that we're there, but how do we continue to bring this and mentor the next generation with us? And for me, that's huge with our police officers and our staff here that are saying involve them in the decision making, even if they're a dispatcher, an officer, or whatever it is. I'm not in a quote unquote leadership position yet, but bringing everybody and including that in a physical capability, but also seeking their input. Oftentimes I go to my student employees. We here at my college, we have a lot of student employees that are 18 to 20-year-old females studying criminal justice, wanting to go into law enforcement. They don't have all the answers we think, but they have a lot of the answers about what our students need and how do they feel and what do they need as an aspiring female leader. What sort of connections and networking and availability do they need to become successful too? So for me, that's a huge portion of that is building that culture of of inclusivity, is really looking down to the next generation below us.
Well said. All right. Okay, I'm going to pop over to the next question now. We have a couple more to go. All right, so for individuals, whether students, faculty, or healthcare workers, what practical steps can they take to advocate for and contribute to a safer environment for women in their institutions?
I suppose it's again around, as we say, safety is everybody's responsibility. And to maintain a safe environment, people need to feel empowered and safe to speak up when they see behaviours such as, sexual harassment, stalking. They need to feel that if they speak up, they're going to be heard. And that action will be taken. So I think, again, it's around that education across our community. And that starts as soon as people join our community, be they a resident on campus, be they a student who visits to study and then leaves the campus. But we're trying to instill those behaviours that we want to see out in the community beyond the campus, and what is respectful. So I think that really starts, well, it should start before people get to university, but we have a role to play in instilling that in our community. So I think it's about having education awareness programs and ensuring that people feel safe to report, so empowered and know that something will be done.
And the only thing I would absolutely what Tara said, and people when they report, the accountability piece is huge because we hear that a lot. Is this person going to be held accountable? But what accountability is for one person is different lens of another person. So explaining to people what it means and what accountability means and what the university will do to protect them if they're victims, if they're reporting. And again, like Carrie knows, we have certain required reporters here on our campuses. There are CSAs, and they're required to report certain things based on their position. So people feeling comfortable to go to those CSAs, to come to public safety, to come to law enforcement, and then that something is going to occur, meaning someone's going to look at it, someone's going to vet it, and someone, if there is an issue there, employment or student, someone's going to be held accountable, and there's an outcome that changes behavior of whoever that was or changes the behavior of the community because they see accountability happen. So everything you said, and then that accountability piece.
Absolutely agree. And it's about walking the talk. I think you can have a really strong policy that says we have zero tolerance, but you have to walk the talk, and staff need to see that from their leaders. They also need to feel safe. So they need to not be victim blamed if there was an incident. They need to feel supported to be able to have a voice. So it comes back to that really strong safety culture messaging and psychosocial safety for our staff or community to be able to speak up.
All right. Chief Ramsdell, any?
I think it was all said. The couple points I was going to make, you all hit on. So lovely way to end. Thank you all.
Wonderful. All right, so I think we have time for one question, and then, so I'm going to ask this question, and then we can do kind of a final, parting thoughts, and then we'll wrap this up. So the question is, as universities increasingly opt for 24/7 campuses to support students' desires to access services at a time that suit them, have you had to evolve your safety strategy to keep your community safe, in particular for women, out of kind of regular hours?
You go, Kerry.
No, I was just going to say that's a great point. It's a really, really great question because we've seen that evolve. You guys have talked a lot about international student population, and that's something that's increasingly here at Endicott, as well as we see sort of global risks hitting our world. We are having to be more in tune with risks and safety planning and accessibility of those students because they're no longer within my gated campus here on campus. They are wherever it is in Australia, in, Paris when terrorist attacks happen. So there's more of an accessibility, accountability piece for us here in campus and public safety. So that is something we are managing. I don't know exactly what the great answer is. I will say I know Safe Zone, when we have heard and talked to you guys, it creates a great opportunity for us to provide additional services at that after hours and off-campus accessibility, because traditionally here on my campus, we have often, like I said, been a highly residential campus. So we're having to adapt and do better about that yet. So I don't know exactly what the full-time solution is yet. But again, working with our campus and thinking about that from, the wellness, from the therapy after hours, from the safety planning to accessibility of law enforcement services, not just on campus, but off campus, out of country, wherever it may be, is a huge piece of the developing piece for us here, I think, at my campus.
Yeah, I think for us, yeah, being a 24/7 campus with we have over 4,000 people living on campus, but we're very much a very open environment. We're not gated. So we're within a, we have a hospital campus right adjacent to us, and part residential. We have a light rail service that goes straight into the city, 7 kilometres away from the city. So it's a very active environment. So for us is, again, just back to basics, high visibility, patrols 24/7, but we also have access after hours. So our control room team are 24/7 and they have an escalation process. So if there are any serious incidents after hours, we have an on-call security manager and they then will escalate onto the other services within the university. So our psychosocial team, our wellbeing team, we can access them 24/7 to ensure that we can provide the services and support we need to if an incident does arise after hours. And particularly also our residential deans are available as well if we need them. So I think it is important to have those supports 24/7 when you are a 24/7 operation.
Great. All right. Okay, so we actually just have one more question that came in, and then we'll go to the parting thoughts. Promise, sorry. All right, so it says, you talked about technology being a hindrance to safety at the start of the webinar. I think maybe like the cyber digital piece of it being a risk. How have you utilized technology to keep women safe?
Well, we have, of course, we've seen Safe Zone product, and it is definitely an industry standard, but all of us are not at that industry standard yet. We're at bits and pieces, piecemealing things here. Our mental health team has a way to connect with our students separately, and then we have a safety app that we utilize for people to be able to let us know where they are. We can do virtual walks with them. Like if they're in a place and they say, hey, I need to, I'm moving from this building and heading to my apartment right off campus. We have over 4,000 cameras around our campus. And so we're able, and we have 24-hour, 7-day-a-week monitoring of those cameras. And so we're able to do those virtual walks. They're able to give us their location, and when they give it to us, give us permission, we can geolocate them. So we provide some of those, and of course, training on how to be safe. If you're going to downtown LA, what to do, what not to do, and those type of things to keep them safe. But electronically, it's really through the app because it's in their hand all the time. That and some seminars and talking to our sorority moms club, those type of things to keep them safe.
And I'll just hit on that. You hit a little bit, Loretta, too, with the training aspect, and this might be an interesting response because I would, we did speak at the beginning about how the social media presence and whatnot of our students and online presence can be that hindrance, but as well as for us as a department, as a public safety and police department, serving college age students, and the app and the phone and everything's on their phone and on technology is leaning into that. So we lean into and have a pretty big social media presence as a department. And that covers all those things you just said, the training pieces, the advertising, the reporting mechanisms we talk to, the safety alerts, so they're aware of that. It has safety reminders, programming, accessibility, anonymous tip lines, and it is a mechanism for them to contact and reach out to us. So we sort of lean back into that, knowing that they use technology, our student population. So we lean into that and really try to connect and do a lot of work in the social media space for our students and our staff, just because we know that's where they are. So we're trying to meet them there and do some educational pieces in that as well, too, to help them.
Fabulous.
Yeah, I think as we say, it's about adding to and building on that comprehensive approach, really. So for us, the safe zone application where people can also report where they feel unsafe on campus. We have done previously as well campus safety walks where we'll set up an evening, invite, and mainly it's residents who on campus who will attend, and then we just walk through with the protective services team and our facilities team and ask the students, you know, do you feel safe here? You know, identify any areas where they say, oh, I never walk down that way because I think the lighting's poor there, or I'll always go this way. So just trying to get that general feel back from the student cohort, and some staff will also attend, and that might give us some action points that we can implement. And yeah, just making sure CCTV without being invasive, but you know, it's there to provide that deterrent, but also provide reassurance that, again, we are monitoring CCTV. We want to detect things prior to any incident, and that, you know, we have the team on the ground there to support safety escorts, etc., and a campus night shuttle service. So ensuring that integrated approach really of safety.
Wonderful. All right. Well, I want to first just thank you all for joining this. This was a really wonderful discussion. But before I let everybody go, I wanted to have everybody kind of have the opportunity for any last words, anything that, you know, we didn't get to cover or share that you'd like to relay to the audience.
I suppose one thing I would say is I think like the event today was enlightening for me to hear from other you know, US universities and healthcare in Melbourne, just understanding how other areas approach safety. So there's always learnings, and collaborating with our peers, I think is really important. It can give us insight to, without trying to reinvent the wheel, but understand what trends are happening in other institutions. So I think that's really important as well.
I actually wrote down a couple of things that Tara said. The sit and forget, because you go into all these strategy type meetings and we don't have an action that comes out of it that we do. And then add in the students, we do safety walks to check lighting and cracks on campus, but we don't have students there. So that's something we probably need to incorporate because they can tell us what areas on our campus that we're looking at them from our perspective, but adding students to that safety walk. And then, you know, just always hearing from wonderful, powerful women is always invigorating and exciting for me to be a part of. So I thank you for having me and allowing me to just be part of such a great conversation with my you know, Australian counterpart. So I learned a lot. I really appreciate it.
And I'd just perhaps like to finish up also by saying thank you so much for hosting this event. Safety is everyone's business, which we have touched on, and culture is critical to a safe environment, whether you're in a university or in a healthcare environment, and listening to the people on the ground, and allowing them to have a voice, because you might miss some really important nuggets of information.
I echo that. Thank you very much. And I think events just like this, where we promote, empower, and work together and collaborate is hugely important, as I said, as we sort of, you know, make the road easier for women behind us and safer for women behind us. So I think a piece of that. And the only other thing I would say is, for me, it's really a huge building that culture of trust. Loretta kind of hit on it too. That piece of accountability is making sure that we're breeding that culture of safety, everyone's business, but also that our campus trusts us. For me, particularly in law enforcement, there can be an untrustworthy position, but having that piece of trust from our campus and engaging in our campus so that they do trust me as a beacon of safety, but also that they can be forthcoming and open about unsafe situations as well too. So that's something I sort of, especially as a female, try to be open and honest about building that kind of culture of accountability and trust here.
Great. Well, I again want to thank you all for joining. I want to thank the audience for joining. We'll be sending this out to everyone. If you signed up and you didn't make it, you will get a copy of this. And yes, let's just keep the conversation going, and let's work together to build safer environments for women, but really everyone. So with that, have a great rest of your day. Thank you.
Thanks all.